Afternoon, everybody. Thanks for being here. I don't know what number this is for us. We got to be in the hundreds, don't y'all think that we've done a couple hundred of these?
Probably.
Yeah. But thanks for being here. I run down some quick numbers for Medical Center. Our numbers in the hospital look much better today. We are at 45 patients in the hospital. That is great. If you remember, we've been rocking along in the 70s for the last couple of weeks. So to be down to 45 is a good number for us. We've tested 18,268, 13,000 of those have been negative, 5,000 and change have been positive. So the testing still continues. In our house today, 24 critical care patients, 19 of those are on the ventilator, 9 on 4 Central, 12 on 7 Central, and 1 suspect in our ICU. We just tested that person, so that should come pretty quickly. We'll get that done. I saw our patient list today from the region. It's the usual suspects with Andrews, Pecos, Fort Stockton, and that seems to be, here we go, Andrews, Crane, Pecos. So that seems to be our usual group. So we're happy to have them here. So that all looks good. We're very pleased with the 45 number. I think that is some positive direction for us, but I don't think that's any reason to celebrate too much, because we all know that as quickly as this falls, it can rise that quickly again. So I think we have to continue to do our parts, wear our mask, get vaccinated, wash your hands, social distance, and just be safe out there. That's what everybody we've been doing for such a long time. I know there's a little burnout on that, but you can see that our numbers do continue to improve. So I'll just update real quick on our COVID vaccine situation. We did receive our next allotment yesterday, so it's here. We'll be ready to roll that out tomorrow. Trevor, did you want me to talk about the region, or are you going to handle that?
You can go ahead and mention that real quick. Yeah, that's perfectly fine.
Yeah, just a quick update on the region where we've sent these out. We have 500 in Andrews County, 250 in Winkler, 500 in Upton County, which is Rankin. Fort Stockton or Pecos County, they had 500 and they did ship 2 of those down to Sanderson, 200 of those down to Sanderson. That's Terrell County. Sanderson has received 0 this whole time, so they were very happy to see those. In Ward County, Monahans also did 250 on Thursday and Friday. They got those out. So our regional folks have been working really good there. I've been moving those vaccines along. They all call and want more, and we want to give them more. So we'll continue to work with that, but we'll be ready for our clinic tomorrow. Of course, it'll be windy. The only day it's going to be windy is going to be tomorrow and Thursday, so get ready for that. With that, I'll turn it over to Kristen and let her take it from there. Kristen?
Not a lot of extra to update, other than just the reminders on the vaccine clinics that Russell just kind of talked through. We will be rolling out only first doses at Rattler. So we want to make sure that everyone understands Wednesday, Thursday, Friday from 9 to 3. Fridays only as long as we have vaccines. And then that is for the first dose only. The booster shots are coming around quickly. We all know that many of our boosters start the week of the 14th. So we'll be rolling out that schedule the end of this week. By Monday at the latest. We have those plans worked through. We just need to work through a couple of dry runs so that we can make sure we work out the bugs on our system first before we have you guys come through. They will be at our clinic locations, so more to come on that. We have a very good process lined out to where we can do within the clinic setting 900 to 1,000 a day to really try to rush through those 8,000 that we're actually closer to 8,500 that we did last week, and then move into the other shots in the weeks to come. We do, for employees here in-house, only have 10 out as of today. We do still have some state and relief staff here, but not very many, as we're slowly starting to come and see those contracts come to an end as numbers start shifting here within our organization. So that's really pretty much all. Make sure you bring your driver's license and you pre-register if you're going to come for vaccines. We look forward to seeing everybody. I think the average car I got out of there in as low as 25 minutes and as high as about an hour and 20 minutes. So it really is just kind of dependent on the time that you get there. But we're really moving them through. So we appreciate everyone's patience, and we'll see you guys out there tomorrow.
All right, Stacy, would you like to go over ORMC's numbers?
Yes, thank you, Trevor. To date, Odessa Regional has tested 10,463. 2,190 of those have been positive. In-house today, we have 21 COVID positive patients. 15 of those are in the ICU, and 4 of those are on ventilators. 9 or 48% of our in-house patients are outside of Ector County. We have patients here from Alpine, Fort Stockton, Kermit, Levelland, Monahans, Fort Davis, and Colorado City. Staff out on quarantine or self-isolation today is 9 for Odessa Regional. Then for Scenic Mountain, our census today for COVID positive patients is 7. That's 2 in the ICU and 1 of those on ventilators. So the census numbers are up just a little bit for both facilities. Staff out on quarantine or self-isolation at Scenic Mountain is 2. And we do also have a little bit of state help also at the 2 facilities. As Kristen indicated, we know that they are getting ready to start demobilizing more of those over the next several weeks. So we'll see those numbers start to come down even further. That's all I have, Trevor.
Thank you, Stacy. Dr. Seravanen?
Thanks, Trevor. The only thing I wanted to add for today is about the CDC's website. They've gone through quite a bit of updates on that website, and they've reorganized it so that information is easier to find. You understand this has been around for almost a year now, and the CDC has been making updates, so they now refreshed the page so it's a little bit easier to find. There's 2 specific sections on the CDC website that I feel will be very useful for people to know about. One is about the new variants, the 3 new variants we've talked about, the South African variant, the Brazilian variant, and the UK variant. It gives you a little bit more information on those and what the CDC is doing now to research on how the vaccines are effective or ineffective against these variants. So far, everything looking good. And the second is about international travel. There's specific guidelines to international travel. For those of you who have had to travel, you know that there is a test required 3 days prior to travel. And once you come back from international, there's a quarantine period as well. The CDC just clearly states those. Those 2 updates are very useful to look at. There's plenty of frequently asked questions about vaccines. You'll see a lot of the questions that we get from the community that we answer through the town hall meetings. Most of those questions are answered on the CDC's website, including some of the more difficult ones about how it works if you get infected between the 2 doses of the vaccine, how it works if you get monoclonal antibody treatment. Those are complicated topics, and it's good to listen to it on press conferences, but it's even better to read about it on the CDC's website. So that's the only thing I wanted to mention for today. Thanks.
All right, thank you, Dr. Seravanen. Dr. Janida is joining us from the health department. Sir, do you have anything you'd like to add? I think you're muted.
Mistake. Good afternoon. I always make the same mistake of not opening my microphone. Anyway, we're working through our second doses, or the first 200 that we gave. We're working through the second dose right now. And of course, when we finish that, we'll go through the next 500. And we are still partnering with the DSHS regarding the assisted facilities, the courtyard, as well as the nursing home, the Lincoln. I also like to inform you that we lost Amrinda, who is the epidemiologist, for the county. And that explains why we've been so, short-handed in addition to losing some of those contact tracers. So it's really going to be hard on us even more. Of course, I don't know if Tracy discussed the partnership we're having with MCH in vaccinating schools and the teachers. So Tracy, are you still there? I mean, Tracy, I'm sorry.
Yes, sir, I'm still here. I just have not talked through that since we haven't finalized all those plans with everyone that's involved.
Okay, just, we're partnering with MCH to work into with the schools. That's what I have. Oh, by the way, I just want to piggyback on what was discussed regarding the, the positive numbers from the hospitalization. My experience is that once you start seeing decrease, actually, let me reverse that. Hospitalization to me is an indication of what's going on in the community, whether we test or not. Because even if we don't test, people who are sick that we don't know about, which is the value of testing, as well as all the other requirements that we have. Even if we don't test, people will get sick enough to either go to the hospital in like an emergency room and end up in the hospital. So numbers in hospitalization tend to tell me what's going on in the community, and a downward trend of that, even though you don't want to, jump the ship. We are seeing that in the whole nation now, but at the same time, we have to hold that breath. Experts are still predicting that we may see another wave because of the mutants that are coming in. But it also speaks to one, the vaccination, two, the masking, three, and all this other spacing that we talk about, as well as the sanitation. So this is something that we just need to keep following and keep our ears to the ground. Thank you.
Thank you, Dr. Janaidu. Kristen, quick question that I've seen too is, I know we haven't released the full schedule for the next few weeks at Ratliff, but there will be a couple of weekend days upcoming for people that can't make it during the week, correct?
Right, it's every week, Wednesday, Thursday, and Friday until the 26th of February. And then the weekend, because we had Sundays booked and the next two Sundays have a very large event, we're going to skip all the way down to the 21st. And so that will be for sure a weekend. And then we'll see where we are as a community to see if we need to add one more.
Okay, perfect. Thank you for answering that question. Let's go ahead and get to media questions here. And looks like top of the list here is Mr. Federico Martinez of Odessa American. Go ahead, sir.
Thank you. Hope everyone's doing well today. I have a question. I hope you can unconfuse for us. We're getting a lot of different responses from nursing homes in the area. Some nursing homes are saying they haven't received any vaccinations yet. Others are saying they've gotten both or at least one. And so we're kind of wondering, how is that being divvied up, or who's overseeing the nursing homes?
This is Dr. Janaidu. As I mentioned to you, we're partnering with DSHS. DSHS has a vaccine. We just help with them. So nursing homes and assisted living facilities is a partnership we have with the DSHS. So DSHS has the vaccines on those.
So just to add to Dr. Janaidu's comments, we initially, when all this happened, us as well as the health department, we called all of our nursing home assisted living type facilities to find out what their plans were for vaccines, so that we could really get some good coverage there, and also have an idea of what manpower would be needed to either go to those facilities or bring them to us. So the health department made those calls as they knew they'd be working with DSHS, and then we made those calls. Everyone said they had a plan. Within 2 weeks ago, we started getting many phone calls that said our plan was this particular pharmacy, they're no longer getting it. So can we bring them to the stadium? Or what are our options if we can't get to the stadium? So those are conversations that we're having in partnership with the health department. I met with Brandy just yesterday, and so we talked through some of those. We have seen some that are able to come to the stadium. We kind of fast track them through so that they're not waiting in any of those long lines, so that they can get back to their organizations. We've had some the disabled homes. We've had a couple of them come over. I know we're expecting another couple from the Rock Houses. I know Parks has sent some, Memory Care has sent some. So I think between the stadium and the health department working with the state, we're really trying to get a good idea. It's just most of these facilities had a plan and it's kind of fallen through. So we're having to start patchworking with the health department to make sure they're covered.
Okay, and I know things evolve and change constantly in this, so that's understandable. Thank you. I wanted to just to review, make sure I understand. MCH just received their new shipment this week, which is 3,900 doses of Pfizer.
Yes, sir.
All right. And now does Odessa Regional Medical, excuse me, Odessa Regional, do they have any vaccines now?
So unfortunately, we did not get any this week so far. There is
Okay.
an allotment of 100 that's listed on the website, but it still doesn't show as shipped. So our efforts are going to be the ones that we do in partnership with Medical Center Hospital.
Okay. And how about the county? Does the county have any?
Dr. Janaidu, you're on mute again.
Sounds like he's still on mute. So from what I heard from the judge
here.
earlier today, oh,
Now,
go ahead.
again, we are still waiting for, can you hear me now?
Yeah, we can hear you.
Yes.
Okay, yeah, we're still waiting for shipment from the state.
Okay. How much are you hoping to get, or how much did you ask for?
Well, again, the first, so far we did 700, the first 200 and then, 500. We're working through the 200 right now, and we'll be, expecting to get the remaining 500 as soon as we can get them.
So we've got 500 right now that you're working with?
No, 200.
200, okay.
But
And is that
Frederico, just
Moderna
to
or
clarify,
Pfizer?
those are the second doses.
Yes,
Those are not
exactly.
first doses.
And that's what I said at the beginning, that we are working through our second dose of the first 200.
There we go, okay. And that's of Pfizer or Moderna?
The Moderna.
Okay.
The Texas DSHS had a plan. You asked about nursing homes. They had a plan to cover nursing homes using local pharmacies. What happened is that they pivoted their plan to vaccination hubs about a few weeks into their vaccine distribution. So since they created vaccination hubs, they've stopped sending out vaccines to the smaller providers. So the ones that got vaccines in the beginning stopped getting vaccines. And as long as there's a hub in your area, their expectation is your hub will help coordinate the regional effort. And that's why they keep sending large amounts to places like Midland Memorial and Medical Center for our area. And they expect them to help coordinate with the whole region. So that's what's happening right now. And that's why we are starting to reach out to nursing homes. We're starting to reach out to educators. We're starting to reach out to different populations that we can hit. So the strategy changed at DSHS, and that's why you're seeing all these other providers that are registered with no shipments coming in.
Yeah.
I see.
And to follow up on that, if you all been following what's going on, the amount of vaccines on hand is actually less than what was initially promised. And they are now adjusting to kind of ramping it up some more. And so the strategy is now to begin to look at where you can get your best, activity, which is why they're creating the hubs and kind of reducing the activity to less, areas, that cannot, or that, small providers as such.
Sure.
It's a question of supply and demand.
Okay. I thank you so very much. That's all I had.
All right, thank you, Mr. Martinez. Appreciate that. Next up on the list, I see looks like Sammy from News 09. Go ahead, Sammy.
Hey, you guys. This question is for you, Russell. This morning at Midland's press conference, it kind of seemed like there was a change in tide here with the positivity rate being really low, testing rates are lower, more and more people are getting the vaccine. Like finally things are starting to look up. And I talked with Brandy this morning and she explained that, you know, during the peak of the virus, you guys were seeing about in Midland and Odessa, about 80 positive cases a day. Lately, it's been around 8 to 15 cases a day. So a pretty significant decrease. How do you feel about that trend, that downward trend?
Well, I mean, downward is the direction we want to go. I mean, that's the goal of all of this. I think one thing, Sammy, we got to be careful of here is in a downward trend, people tend to get relaxed and they think it's okay to gather in groups for the Super Bowl, to not wash their hands, to maybe I don't need the vaccine. I think we have to be very careful here about the message that we have. The message is, hey, keep up the good work. Keep your mask on, keep washing your hands, keep doing what you're doing. And because look what it brings. It brings a downward trend in the numbers. I think the flip side of that is don't get relaxed because you're seeing that. The only reason we're seeing that is because the hard work that everybody does on every level to keep safe, to make sure that we're being responsible and we're just taking care of each other. We like the downward rate. You know, one thing Dr. Saravan talked about earlier today is the flu rate has been nothing. I mean, one good thing is this has knocked the flu rate way down. And so the flu is out there, but not near what it used to be. And so there's a lot to celebrate here. You know, give it 8,500 shots in 4 days is a lot to celebrate. But as awesome as that sounds, that is a drop in the bucket in this ocean that we're trying to bail. And we just have to continue to work together, continue to push through, continue to be responsible and make sure that we're taking care of our neighbors and that we're getting things done. So we like it. We like the downward trend. We want to continue to see it go down. We don't want it to get into this roller coaster business. We want it to go down. It's going to be an economic driver for our community. The lower it goes, the more people can go into restaurants and hopefully someday the movies will open back up and things like that, and we'll be back to a normal life. And so we're happy with the downward trend, but we got to keep it down and we got to keep doing what we did to get it there.
And to add to that, this is Dr. Janadu. You know, I get very nervous when activities or holidays are coming up because, again, as Russell said, just because we are going down, we do not want to let down our guards. And we don't want to count our chickens until they're hatched. When you have activities like the Super Bowl coming up, it's the more reason we want to really emphasize the need to continue to mask and limit the amount of gathering, perhaps no more than people who are in the same household, rather than our traditional Super Bowl celebrations. Again, the mutant is something to be scared of, and until we get a greater portion of the population vaccinated, even then we still have to continue to do our masking, to do our spacing, to continue to wash our hands, and to avoid just getting too complacent about any good news as such.
Yeah.
And I also, Janadu, I think you're right, and I think one thing we got to be careful of out here in West Texas is all these people talking Sunday when the Bucks win the Super Bowl. So I think we got to be very careful of that too.
I thought you were a Chiefs fan.
Look right here. I've been a Bucks fan back in the day, way back in the day.
Oh man. Well, I can get behind you cheering on the Bucks, but the Chiefs, I don't think so. And then my other question for you, Midland feels like they are ready, they have a good start on green light and gives them the vaccine. They're ready to get rocking and rolling on that.
I'm sorry, you're cutting out, Sammy. We can't hear you.
Sammy, you cut out a couple times during your question.
Okay.
You're still cut out, Sammy. Sammy, you want to type your question in the chat bar and I'll get to it. Yeah, she's not muted and she's still out. So All right, we'll go back to Sammy. See if Sammy, if you can hear us, type your question in the chat bar and I'll get to it. But let me go on to Mr. Scott Pickey before we get to Sammy's question. Scott, go ahead.
Thank you. I just want to remind everyone the Super Bowl you speak of is on CBS 7 Sunday night.
Oh, gag me.
Oh, now Sammy's back. Okay.
Oh, now she makes it back.
Yeah, sorry. AT&T Wi-Fi there. Sorry, Scott, go ahead with your question.
That's all I had. Go ahead. You're good.
Okay. All right, Sammy, go ahead. You're good.
My question was, are you guys ready for phase 1C? Do you feel like you have a good start on phase 1B and you're ready to add more people to that criteria?
I think that we are ready. I think that our partners like Odessa Regional, our regional partners like Fort Stockton, Rankin, Andrews, I think they're ready. In fact, we're talking to Austin right now, asking them to send us more. I mean, we want more vaccines. We think if they can send us more, we can get those out faster and in more spots and in the region. And so we think that our plan is good. We think our exit plan out of Ratliff Stadium is good. And we think that partnering with people like Odessa Regional and other hospitals around us is a great plan. And our first run through these first 2 weeks have been excellent. And we think that we are ready to put the pedal to the metal and get this going. So bring them on.
Yeah. And who do you hope is included in that phase 1C criteria?
Well, I know Brooks Landgraf, our representative, has filed some paperwork to try to get teachers put in 1B. So 1C opens way up, but there's a lot of people in 1C.
Yes.
But we definitely want the teachers to be involved and they're out there too. We want that opened it up to people who want the shot. I mean, right now you got pre-existing conditions, 65 and older. There's a lot of things you got to jump through. But so we want to see that broadened open so we need the herd immunity. We need to get that going. So I think the more, go ahead, Dr. Janadu.
Yes, bear in mind that it's always a question of supply and demand. There's a tremendous amount of demand out there, and the limiting factor is the supply. The more we can get, the more vaccines we can get, the more it can be opened up. The ultimate goal is to vaccinate the whole, the public in general. And the more public we can get to the point where we can have good herd immunity is when we can have a real breathing room. So your question is, it's not a question of whether or not it's 1C, but it's a question of demand. I mean, supply rather. The demand is there.
Sammy, just so you know, our number that we're talking about is we're asking for 5,000 additional a week. So that would put us close to 10,000 a week. And I know that number sounds big, and a lot of our employees and volunteers that have been out there at Ratliff Stadium, their eyes probably just got this big around. But we think if they can roll 10,000 a week into Odessa, that we can do the heavy lifting and we can get those distributed and get those in people's arms quickly. And so I think that all of us working together has proven that local control is where the difference between getting things done and not getting things done happen. And so if we were up in the 8, 9, 10,000 a week, we think we could move those very quickly.
Yeah, so the state has said that once phase 1A and phase 1B, once those folks are vaccinated, then about half the population in Texas will be vaccinated. Do those numbers align here, or do we maybe have an older population that it would be a little more than a half, a little under? What's your gauge there?
Yeah, I would probably say at least half, if not more, of the population would be covered in phase 1A and B in our community. The Texas COVID-19 vaccination plan is published on the DSHS website. So if you pull that up, just Google Texas COVID-19 vaccination plan, look at page 12, it'll go through the different phases. So obviously they haven't published phase 1C or phase 2 yet. They don't know if it's going to be called 1C or phase 2, but the priorities and the order in which these priorities will come out is published. Look at page 12 on that Texas vaccination plan.
Okay, awesome.
You also want to factor certain aspects into, what we call population. Bear in mind that we're still working on, children. So when you take the percentage of the population and exclude the children, That's one thing. So when we're talking about what part, or how much population we're going to vaccinate, until we are able to really start vaccinating children, we are still out in the woods on that. There's also the group that is anti-vax. My reading is that a lot more people are becoming, are coming to accept the vaccine much more than in earlier days when everybody was saying, I'm not going to take it. And I think the fact that there have been, people like, in the group 1A that have received the vaccines and there have not been any much disasters, so to speak. I think more people are becoming more acceptable and receptive to taking the vaccine. But we still have to understand there are still going to be some group that are not going to accept the vaccine no matter what, along with the children. So when you now look at that population, you still have to understand there's those who cannot, or who are shut in, that cannot come out. Those ones have to also be, we have to understand that those ones we have to plan for. And so there's so much work to be done. And that's why we have to continue to do the basic things like, masking and spacing and sanitation.
Right. So we talked about like a changing tide. Things are starting to look up here, but when you look at the numbers, it'll be interesting to see what the 2020 census has for our population here in Midland and Odessa, but let's be a little liberal with that number. 400,000 people are out here between Midland and Odessa, the entire Metroplex. And of those, around 400, probably a little less, maybe closer to 300,000, 28,000 have been vaccinated this week. So even though we're seeing the positivity rate go down, it's not necessarily due to the vaccine, right?
That's exactly right. So if you look at the vaccines, you have to receive 2 shots and you have to wait a week or 2 after the second shot to actually be immune. So we haven't crossed that point for many thousand people yet. It's a few hundred people that we have crossed that that threshold of a week to 2 weeks after the second dose. So as this continues to roll out, the several thousand shot rollout is still second dose pending. So after those people receive the second dose and we wait a week or 2, then we can start to say a reduction in our positivity rate, a reduction in our hospitalization rate is secondary to the vaccine. At this point, it's not quite secondary to the vaccine. It's because of the precautions that we've been following. So like Russell was saying earlier, that's what got us here. Let's not go backwards. Let's maintain course and keep at it so that we can continue to keep this controlled.
Interesting. All right. Well, thanks, you guys. Appreciate it.
Thanks, Sammy. I pretty much think that's everybody. Let's see here. And again, Kristen, I want to reiterate, we had several people ask on Facebook. We'll release that information in the coming days about second doses for those that showed up the first week. Those will probably be at our clinics with appointments, and we will give information for dates, locations, times, how to set appointments, etc. here in the coming days. So that information will be coming, don't worry. The first date wouldn't even be until February 14th for those that participated in the mass vaccination drive-through last week. Russell, do you want to go ahead and close us out before we reconvene on Thursday? And hopefully by Thursday, we'll have administered another close to 3,900 vaccines.
Well, I just want to tell everybody thank you. We had a little meeting this afternoon and we had one request, and really it's 2. We need volunteers still, volunteers. And ultimately we need you to lift those people up in prayer out there. We need for their safety, their family safety while at the stadium, and just being safe and making sure that everybody is out there is just protected. So if you'll please offer that prayer up tonight. And just a quick message to anybody at the state level, if anybody at the state level watches this, hear us loud and clear. We want 5,000 more. Bring them on. Read our lips. 5,000 more. We'll take them and we'll get them in people's arms. So I hope somebody sees this, and I hope my phone rings this afternoon and says, all right, you got it, big boy. Here we go. Let's get it on. So we want them. We'll take them and we'll move them out. My verse for today is from Proverbs 16:3 that simply says, commit to the Lord whatever you do, and he will establish your plans. Thank y'all very much. Have a good afternoon.
We'll see you Thursday.